Corneal opacity. That's our next topic. The word corneal opacification literally means loss of normal transparency of cornea, which may occur in many conditions. So, you all know opacity means nothing but loss of transparency. So, loss of transparency of cornea is known as corneal opacification. It can occur in many conditions. Therefore, the term corneal opacity is used particularly for the loss of transparency of cornea due to scarring. So, here the corneal opacity is used for corneal scarring. That you have to keep in your mind. Okay, corneal scarring is what here it is mentioned as corneal opacities. So, before that, we have to understand what are the things will maintain the transparency of cornea. So the transparency of cornea is a result of, first one is peculiar arrangement of corneal lamellae. The peculiar arrangement of a lamellae in the cornea is one cause for a transparency. And second one is avascularity. There is no vessels. You can't see any vessels inside the cornea. So avascular. And the third one is relative state of dehydration. So these are the three reasons for the transparent cornea. So first one is peculiar arrangement of the corneal lamellae. Second one is avascularity, and third one is relative state of dehydration, that is maintained by the barrier effects of epithelium and endothelium, and the active bicarbonate pump of the endothelium. So due to that, there will be a relative state of dehydration. So these are the reasons for a transparent cornea. First one is a peculiar arrangement of corneal lamella. Second one is avascular structure, and the relative state of dehydration is the third one. Due to these three, there is a transparent cornea for us. Next comes the causes of corneal scarring or corneal opacity. Corneal opacity may occur as developmental anomalies or following birth trauma. So, congenital opacities will happen. Congenital opacities can be occurred due to developmental anomalies. Some developmental anomalies are due to a birth trauma. During birth, if there is any injury, that will also cause congenital opacity. The second reason is healed corneal wounds, and the third cause is healed corneal ulcer. So I think you know the difference between wound and ulcer, right? So wound is mainly due to external cause, external injury, and ulcer is from the internal disease or internal cause, that is known as ulcer. And from externally, if any cut or incision is happening, that is called as wound. So that is the difference between wound and ulcer. So these are the causes for opacities. So first one is congenital opacity. It may be due to any developmental anomalies or due to any birth injury. And the second one is healed corneal wounds, and third one is healed corneal ulcers. Clinical features. Corneal opacity may produce loss of vision or blurred vision. So two things can be produced in corneal opacity. First one is loss of vision. Vision will get lost, or second one is blurred vision. Vision is lost because a dense opacity is there in our pupillary, in front of our pupil, that opening in the center of the iris. Then how light will pass through the lens, and it will fall in the retina for getting an image. So there the vision is completely lost, and blurred vision is mainly due to the astigmatism effect. And types of corneal opacities. Depending on the density, corneal opacity is graded as nebula, macula, and glucoma. So nebula, macula, and glucoma. In this picture, you can see the density changes, right? The first one is not that much dense opacity. It is very faint or light opacities, and here you can see the density is much more than the nebula, and here you can see it's a thick opacity, right? So this is glucoma. So first one is nebula, and second one is macula, and the third stage is glaucoma. So these are the types of corneal opacity depending on the density of the opacity. So in that first one is nebular corneal opacity. It's a faint opacity which results due to superficial scars involving Bowman's layer and superficial stroma. You know the layers of the cornea, right? In that Bowman's membrane and superficial stroma, in stroma itself, the superficial stroma only affected. That is known as nebular corneal opacity. A thin diffuse nebula covering the pupillary area interferes more with vision than the localized glaucoma away from the pupillary area. So, this means a thin, diffuse nebula occurring in the pupillary area in the path of vision interferes more. It will irritate more with the vision than the localized glaucoma away from the pupillary area. If glaucoma is a thick, density is more, opacity is more, but if it is away from the pupillary, it won't affect our vision, right? If a small, that is very faint or small opacity is nebula, if but it is in the path of the vision, that is in the pupillary, in front of the pupillary area, means it will cause more irritation than a dense glaucoma which is away from the pupillary area. Further, the nebula produces more discomfort to patient due to blurred image owing to irregular astigmatism than the glaucoma, which completely cuts off the light rays. So glaucoma, if in the pupillary area it coming means also glaucoma means it is a complete loss of vision. No light will pass through that. But it is the discomfort is more in nebula which is present in the pupillary area than the glaucoma, because it will be a blurred, the patient can see but cannot see, it was like that. But in glaucoma it's a complete loss of vision, so it's not irritating or discomfort to the patient. So that is nebular corneal opacity. The density is very faint or very small. Next comes the macular corneal opacity. So macular, here it is semi-dense opacity and the scarring involves about half of the corneal stroma. So Bowman's membrane and superficial stroma is the nebula, and if it is in the till the half of the stroma, then it is known as macular corneal opacity. There the density of opacity is more. And the next stage is leucomatous corneal opacity, glaucoma simplex. It's a dense white opacity which results due to scarring of more than half of the stroma. Here, the Bowman's membrane is superficial, middle, and more than half of the stroma is affected. That is leucomatous. And next comes the adherent glaucoma. Adherent glaucoma. In glaucoma only adherent glaucoma. That is because when healing occurs after perforation of cornea with incarceration of iris. Here the iris got stuck in that perforation. So if that is the condition, then it is known as adherent glaucoma. So here it results when the healing occurs after perforation of the cornea along with the iris, then that condition is known as adherent glaucoma. And the next condition is corneal facet. Corneal facet means sometimes the corneal surface is depressed at the site of healing due to the less fibrous tissue. Such a scar is called facet. So after this corneal ulcer formation, due to the less fibrous tissue, due to the reduced fibrous tissue, it become a dip or a depressed a corneal surface. Normally, you know, right? Cornea is like a watch glass. There is a projection. That cornea structurally it will be like a watch glass. It is projected upwards. But if there is less fibrous tissue, then it won't grow back properly, and it will cause a depression in the corneal area. That condition is known as, that type of scar is known as corneal facet. Next is characterisia. Characterisia is a condition in which the corneal curvature is increased. So because of the weakness or thinning of the cornea, the inner structures will pressure that one. So that portion will get bulged. Cornea is little bulged. So that is known as characterisia. In this condition, corneal curvature is increased at the site of opacity due to the weak scar. Okay, so that is known as characterisia. And the last one is anterior staphyloma. Anterior staphyloma we already saw in corneal ulcer. So here what is happening? Ectasia of pseudocornea. The scar formed from organized exudates and fiber tissue covered with epithelium. You know, right? Pseudocornea is formed which results after total sloughing of cornea in corneal ulcer with iris plastered behind it is called as anterior staphyloma. It is seen in corneal ulcer. In pathogenesis we studied it nicely. So pseudocornea is formed. The pseudocornea is formed with the exudates, right? Above that, the corneal epithelium or this conjunctiva will form, and this iris will be plastered behind that. That condition is known as anterior staphyloma. So these are the types or stages we can see in the corneal scarring. So according to the density, it can be classified into 3: nebula, macula, and glucoma. After that, there is a certain conditions like adherent glaucoma, where the iris will get adhered into the or stuck in the perforated cornea. And then characterisia. Characterisia means that weakness will happen to the cornea and it will bulge out, and anterior staphyloma. Here the pseudocornea um, uh, will be pushed out along with the iris, which is stuck behind this pseudocornea. So these are the conditions seen in corneal scarring. And also facet. Corneal facet means some condition there, if there is less fibrous tissue, means the scarred portion will get depressed. It's not bulged, it is depressed. Then it is known as corneal facet. So these are the types of corneal opacity or corneal scarring. Then secondary changes in the corneal opacities, if it is seen for a long-standing cases, if it's seen it's like chronic condition, then the secondary changes will be seen. They are hyaline degeneration. Hyaline degeneration, you know, right? There is a connective tissue degeneration, that is known as hyaline degeneration. Calcareous degeneration. Calcareous degeneration means there will be deposition of calcium salts in those tissues, and there will be degeneration and there will be necrotic changes. That is known as calcareous degeneration. Pigmentation, there will be change in the color, that is pigmentation. Then arthromatous ulceration. Arthromatous disease means what? Yeah, that is nothing but there will be degeneration in the or a lipid collection or a deposition in the inner wall of the blood vessels. That is known as arthromatous. Arthromatous ulcers will be seen as a secondary change in corneal opacity. So these are the changes we can see. So first one is hyaline degeneration, second one is calcareous degeneration, pigmentation, and arthromatous ulceration. Next comes a treatment. So first one is optical iridectomy. Optical iridectomy means iridectomy, removing of iris, that is iridectomy. So it may be performed in cases with central macular or leukomatous corneal ulcer. If there is central macular or leukomatous ulcer, so the other parts are free, right? Cornea, other areas are fine. Only the central part is having macular or leukomatous corneal opacity. If we do iridectomy, it will improve the pupillary dilation so that the patient can see through the other part. The light will fall into the retina through the other part. Only that central part is there, means only through pupil the light can go. If we do iridectomy, then light can fall through the other part. So dilated, you can see pupil is completely dilated or opened, more opened pupil you can see, and the light can enter through the other parts, not through the middle part. So next is keratoplasty. Keratoplasty provides it's good visual results in uncomplicated cases with corneal opacity, where optical iridectomy is not of much use. If it is not of much use, then we can go for keratoplasty. Keratoplasty is nothing but it is a transplantation, corneal transplantation, that is keratoplasty. And the third one is phototherapeutic keratectomy. Phototherapeutic keratectomy means it's a laser treatment. So here it is performed with the excimer laser. It's useful in superficial and nebular corneal opacity. Here what they will do is using the laser light, they will cut the superficial layer of a cornea. Here only the superficial part of the cornea is affected in the nebular corneal scarring. So that can be did with the laser, that is known as phototherapeutic keratectomy. Next comes cosmetic colored contact lens. If nothing is going to help, that is the vision, we can't improve the vision means don't go for any other treatment. Only cosmetic thing we have to take care. So gives very good cosmetic appearance in an eye with ugly scar having no potential for vision. If whatever we'll do, there is no scope for vision means we have to go for this one. So only that scarring we have to hide. That you can do with cosmetic colored contact lens. Nowadays, presently this is considered the best option above the tattooing for cosmetic purpose. So before tattooing was doing, now they changed that to cosmetic colored contact lens. So that tattooing, we'll see how they used to do tattooing of scar. It was performed for cosmetic purpose in the past. If there is, it is suitable only for firm scars in a quiet eye without useful vision. If any treatment we'll give, there is no vision is coming back, then go for this one, tattooing. For tattooing, Indian black ink, gold or platinum may be used. So how it is used to perform tattooing? First of all, the epithelium covering the opacity is removed. So first outer layer epithelium is removed under topical anesthesia. After that, then a piece of blotting paper of the same size. How much we removed the epithelium, that much same size we have to cut a blotting paper, same size and shape, and it should be soaked in 4% gold chloride or 2% platinum chloride and is applied over that area. And after 2 to 3 minutes, the piece of the filter paper is removed and a few drops of freshly prepared hydrogen hydrate solution are poured over it. So after 2 to 3 minutes, that filter paper or blotting paper is removed. Then lastly, eye is irrigated with normal saline. After that, we can wash with normal saline and patched after instilling antibiotics and atropine eye ointment. After applying these two, we can do patching of the eye and epithelium grows over this pigmented area. So like that, we can hide the scar. So that is tattooing. Tattooing and cosmetic contact lens we can use for just hiding the scar. Okay, so here first epithelium is removed. After that, a blotting paper which is soaked in the gold or platinum is applied over there. After 2 to 3 minutes, we can remove that and then bandage after instilling eye antibiotic and atropine eye ointments. So these are the treatments for corneal opacity or corneal scarring. So hope you all understood corneal opacity or corneal scar.